how I approach cases like this and how I don't just look at one tooth when the patient comes in. So I ask the patient about the tooth, of course, the tooth that they're at my office for, but I also ask the patient about general dentist's plan for the tooth and what the bigger picture is, so that if I can help the general dentist in any way, because of course, me having decades of experience, and not only as an endodontist, but also as a general dentist, practicing general dentist for 5 years before I specialized in endo. So I don't just focus on just one tooth and then ignore if I see there is a flaw in the logic or the treatment planning of the general dentist. General dentists and me, we're a team, and we need to work together to make sure that the patient receives the best treatment possible. So take a look at this case, for example. I just saw this patient regarding tooth number 7. This patient is in her 80s, 87, I believe. And patient was referred to me for endodontic retreatment of tooth number 7. Tooth, as you can see, is a part of a 3-unit bridge. Patient's chief complaint, and I always ask the patient, what are you here for? Patient's chief complaint was, my bridge is loose. There was no indication of this tooth number 7 having any issues or any pain. So I asked the patient, I said, so based on what I see here, this is a silver point obturation. And I asked the patient being in her 80s, I said, this root canal must have been done probably more than 60 years ago. And patient said, oh yeah, how did you know? Patient said, I was in the military in my 20s, and this root canal was done when I was in my 20s. So we're talking about 60 years ago when this root canal was done, 60 years ago. All right. And I asked the patient, have you had any problems, any issues, any symptoms, any swelling or anything like that with this tooth? And patient said, no, I've had no issues with it. I just went to my dentist because my bridge was loose and my dentist is making me a new bridge. And so just wants to make sure this tooth is okay. Maybe there's something going on here, but this root canal was done over 60 years ago. All right. What's going on here? All right, now take a look clinically. So number 7, percussion and palpation all within normal limits. I see a labial swelling right superior to the pontic in number 5 or 4, whatever you want to call it here. Looks like it's probably at number 5. I think patient had number 4 extracted for orthodontic reasons. So that's tooth number 7, that's tooth number 6, that's tooth number 5, and then this is tooth number 3, the first molar, okay? Look here. That's labial swelling and a sinus tract. And the bridge was loose. The bridge wasn't even sitting on tooth number 5 there. And you can see there is just nothing left of tooth number 5. All right, so what did we do? Just to make sure, I went ahead and traced that sinus tract there. And this patient is not numb, so you don't need to give patient local anesthetic if you know how to trace properly and how to warn the patient. It's going to perhaps be a little uncomfortable. Be very gentle, and we traced that labial sinus tract right there. I knew it was going to go to number 5, but just for documentation. It went to tooth number 5. Look here. Look at the decay there. Two prefab metal posts. And of course you can see a lateral lesion there. I probed the tooth and there was nothing really left of the tooth, but just again for documentation purposes, 6 or 7 millimeters. So that tells me that this tooth is gone, right? Vertical root fracture, and of course, huge recurrent decay. So the dentist was going to put a bridge on this tooth. Right there. I saved the dentist and the patient in the process. All right. Right there. This tooth needs to be extracted. Put a bridge on it? No way. All right. So, but I didn't have tunnel vision just because the patient was referred to me for tooth number 7. I didn't just look at tooth number 7 and let the patient go and then allow my referring dentist to fail. Oh, the dentist fails, the patient will suffer. So that's why you have to be passionate about what you do. You have to be caring, and you have to look at the bigger picture here. Take your time. You can't rush these things. You need to take your time. You need to ask questions. You need to listen to the patient. You need to do a thorough examination evaluation. I'm thinking, okay, now this tooth needs to go. All right. Now, now let's say, okay, now I want to say, okay, this tooth needs to go. Now let's turn this into a 4-unit bridge, right? But then looking at tooth number 7 and the fact that this tooth has never hurt, never bothered the patient, but it is still questionable. It is still questionable. Is that a periapical relucency? I don't know. It's still questionable. Why put a 4-unit bridge on a questionable tooth? And if I want to be like extremely aggressive, then I would have to do apical on this tooth. But the patient is in her 80s with extensive medical history. So apical for this tooth? Apical for this tooth? No. Really, no. This tooth has never hurt, never bothered the patient. But also, I don't want this tooth to be an abutment to a 4-unit bridge. So what do we do? What do we do? Also, the other thing is, in order for this patient to get a 4-unit bridge, this crown on tooth number 3 will have to be destroyed, will have to be cut and destroyed. Now, in the process of removing this crown, this tooth can suffer. Now, suddenly this tooth would need a root canal, right? Because you're going to have to cut this crown off with a high-speed handpiece, right? You're going to have to cut it. It could be trauma. Look at tooth number 3. I'm not even sure if a root canal would be possible. Look at it. I can't see anything. It's a block of concrete due to calcification. All right. So why mess with this tooth and turn it into an abutment? I don't even want this dentist to mess with this tooth. This tooth it's not bothering the patient. Why traumatize it? All right. Because as I said, doing a root canal on this tooth may not even be possible. So let's not complicate things. Okay. So I wrote in the report that is my recommendation for the dentist to cut this bridge off, but cut the bridge off here and smooth out the surface of the PFM bridge. Smooth it out. Smooth out the metal and the surface of the porcelain. All right, so that this tooth will retain this 1-unit crown as part of the bridge there. We'll just retain that. And then the dentist can, of course, cut this bridge off from here, as I said, smooth everything out, and then extract tooth number 5 here along with the part of the bridge, right? And just make this patient a partial, a removable partial with 2 teeth attached to it. That's it. This is the simplest way. The best way, the simplest way. That way, we're not messing with this tooth and we're not turning this tooth into an abutment when we're questioning the periapical area here. All right. We avoided an apical on this tooth. We extracted a hopeless tooth here that was the source of the patient's symptoms and labial swelling and sinus tract. And we didn't mess with tooth number 3. We didn't have to cut that crown off of tooth number 3 and traumatize it. See what I mean? I put that in the report to the general dentist, and hopefully the general dentist will listen to my logic and go from there.